So Dr. Tanarak, with the figures, we can see your post on Facebook over the weekend. So can you just tell us the prediction regarding the number of infection? We won't see the figure can be as high as 350,000 cases?
The figures of 350,000 was calculated by some groups, which I don't exactly know who did the calculation. But the numbers has been circulated in the media and social media in the last weeks. I have received so many calls discuss about, is it possible that Thailand will reach 350,000 in April 15. So I gave a comment and answer so many call about this. So in the end, I decided to write something about it and post on my Facebook.
I see. So that the figure, the 350,000, is something not possible, right?
Consider what happened. I don't think it's possible. I think that there's a very possibility that we will reach that numbers in the next less than 20 days.
I see.
They also calculate the number of deaths using the number of 350,000. That there would be about 7,000 deaths in April 15, and those number is very less likely to happen.
But are there any projections that can give us some idea as to what will happen? At least some figures in your own calculation and projection.
Generally, Ministry of Public Health in the process of planning our response to this coronavirus pandemic. We have done several calculation and estimation of what would happen in the next few months or few years. I believe that the first calculation we may have discussed about, we have 3 scenarios that may happen: worst case scenario and best case scenario, and something that's in between. But recently, after we have a large cluster of cases in boxing arena and in the nightclub in Bangkok, recently we make some adjustment on our calculation, and we predict to the same day, that is April 15. We divided our protection into 3 scenarios. That is, if we do nothing, that would be around 25,000 cases, only 25,000 cases. And if we do something, for example, if we can reduce the number of people that come out from home, that is about 50% of social distancing, the number will reduce to about 17,000. And if we do a great job on social distancing, the number could be around 7,000.
Okay, but do you feel encouraged by what is seen as the trend of more and more people practicing social distancing or staying at home? I mean, according to figures from Dr. Tanarak, I mean, more than almost half of the people are now, I mean, chose, at least they stay home or they do not go out on the street.
Okay. Actually, I would like to say that the social distancing is some measures or intervention we would like to do in certain provinces, not countrywide. In some provinces that they don't have any cases, or the provinces that have very few cases, 1 or 2 cases, the social distancing may not be necessary yet. But for the provinces that have so many cases like Bangkok and some other provinces, social distancing would be a good intervention that will augment the intervention that we already done, that is public health intervention mainly. So the more people that can stay home and avoid coming out in public places will be the best. Any numbers will help slowing down the upward trend. But if we want to reverse the trend, we have to do a lot, I mean, a better job than this. There was some calculation from Australian groups saying that at least 80% of people should stay home in order to reverse the trend.
Wow.
So I think we are still a little bit behind the number.
You subscribe to that number, right? 80%. You agree with that calculation?
I think we at the moment, the situation of each country may be different. So, as I mentioned earlier, any numbers will help our situation. If we want to reduce the number of cases down from 17,000 into 7,000, we have to do a lot better job than this.
So it means that people have to be stricter with themselves in terms of working from home, including many corporate, many organizations should impose stricter measure to stay at home and work from home.
I would say so. There may be some figures from public transportation. That is, I think, that we have seen the announcement. But if you look at the traffic in the morning and in the evening, the traffic is still jam-packed anyways. At least in the last few days that I have to travel in and out of Bangkok, the traffic is still very heavy. So I would like to see something that is far better than what we are doing at the moment.
So today, the Public Health Ministry reported another 136 new cases of COVID-19. And it looks like every day we have figures that goes in excess of 100, right? So what do the figures tell you? I mean,
we have to look at the numbers in different ways. Now, since at the moment we have so many provinces that has been affected by the disease, at least about 50, 60 provinces. So it would depend on how each province can tackle that problem. The provinces that have very small number of cases should try their best to contain the disease as much as they can. They have 1 or 2 cases, so it would be, very easy job for them to investigate and contain the cases. But for the other provinces, like Bangkok and some other large provinces, these provinces is the provinces that will have an effect on numbers. I mean that if the numbers in Bangkok increase, then probably the trend of the countries will also increase. If the number of Bangkok decrease, then probably the number of the whole countries will also decrease as well. So we are now looking at what happened in Bangkok mainly, and we focus on how good job we are doing on trying to control the spread of the disease within Bangkok.
So this coming Songkran holiday, even though it has been shortened, it's going to be a decisive moment, right?
Not exactly to me, because we still have to work very hard in order to try to change the trend of the disease. If the cumulative number is one number, but as you mentioned, I believe that the new cases is more important. If you look at the trend of the new cases, although it looks like it's plateau around 100 for quite some days, but I would like to see that it's going down even more than this.
With the number of new cases of infection in Phuket has risen to 42, and with the lockdown policy just in place last night, do you think it's on the right track? And what should we be concentrate on Phuket situation from now on?
Phuket should do 2 things, or 2 or 3 things. One thing, the most important thing for Phuket at the moment is they have to do their best in trying to identify the case as soon as they can. And then they send the team to investigate, trying to identify as much contact as possible. Then they should follow those contacts of the case for 14 days and put them under quarantine. In this way, they can cut the chain of transmission. There is one thing that they must do. Second thing is they have to, or they already impose the social distancing policy by trying to limit the travel within their province, and they will allow not that many people coming out from their home. That is a very good policy. The third things they have to do is they have to limit the travel in and out of their provinces. If there is anybody going into their province, they should also do a very good job on tracking them and put them under surveillance, at least under surveillance, to try to look if they have developed any symptoms. They should identify the new case very soon.
Dr. Tanarak, are we still in this so-called golden period, the period in which we can decide whether we want to go the way of some European countries or follow the footsteps of some of the Asian countries like Japan and South Korea?
There's one thing actually. For communicable disease, to me, any period is a golden period. My reason is that we all, as I mentioned earlier, no matter how many cases we have in the countries, we know how to cut the chain of transmission. If the case stops spreading, there would be no more case in the very near futures. Although we are trying to do, we try to identify cases and try to implement public health intervention. There's one other thing that I think also very important intervention or measures, that is trying to educate Thai people how to avoid the infection and what they should do if they got infected or if they have symptoms, mild symptoms of fevers, cough or sore throat. They must know that. That is a measure for general public. And I still believe that the message of how they should practice their daily life or how they should live their daily life and what they should do if they got infected is not reached a majority of the population yet.
Dr. Tanarak, what's the pattern you see of the infection in Thailand, all over Thailand, in Bangkok, southern part of Thailand, and in the northeast, in Ubon? What does this tell us?
For Bangkok, we already know the situation. The spreading is now getting wider and wider. In the south provinces of Songkhla, Yala, Pattani, Narathiwat, the spread of the disease started with the pilgrims coming back from Malaysia, from Kuala Lumpur, and then the spread was first spread within the family, and then going out from the family to other public places. This is something we already know. We know from the lesson from China. The lesson from China is that the disease spreads so easily within the household. Household contact is the one who is at highest risk of getting infection. So with their tradition, with the way they live their life, their lifestyle of the Muslim in the southernmost provinces, we should even try harder than Bangkok to try to contain or try to avoid the spread of the disease within the household. I believe that at the moment they also try to limit the travel in and out of those 4 provinces, three provinces plus some part of Songkhla, and they also try to implement the social distancing practices in those 3 provinces as well. I believe those things will also help the situation in the south. But as I mentioned, there are a lot of challenging in those areas. Even the languages or the ways that we could communicate or how we can tell them what they should do is also differences from what we are practicing in other part of the countries. The influencers, the person who can influence those peoples are also different from other part of the country as well. And for example, if we're talking about the people in Bangkok, the influencer may be someone we know very well, maybe celebrity or singers or whoever. But in the southernmost provinces, their influencer is different. Those usually will be the religious leaders.
So,
So
Dr. Tanarak, please,
please.
Yes, Dr. Tanarak, last night, I'm sure you must have seen how people across the country came out to offer their moral support to medical personnel who are now seen as the medical heroes. So they came out on the balconies, they went out on the roadsides to clap hands. What does this mean to you?
Oh, it means a lot to me. And also, I think my colleagues and every medical doctor who worked very hard recently and trying to help everybody to stabilize the situations. I would say this way. In the early of the situations, the person who worked very hard may be public health officers. The person who work on prevention and control. Those are the health personnel from Department of Disease Controls mainly. But as the number of patients get increasing, doctors at the hospital now have to work very hard as well. And everybody in the country know that dedication. But I believe that everybody's tried their best in trying to help the countries and Thai people to gain their health back to normal. And I think those things has been recognized and we share the support for each others. I think those are the most beautiful things that we have seen recently.
I think myself and my colleagues owe you and your colleagues a hand clap. So thank you very much for what you have done, you have been doing for the country.
That's right. And what else do medical doctors, personnel, health workers need at this very juncture? More equipment, more support. What do you like to see more?
If I can show you the sign, maybe I would say that we work very hard for you, or we stay at the hospital for you. If we could ask something in return, I would like to say that please, if you don't need to go out from your home, please stay at home. This will make our job a lot easier. The more patient we have to see at the hospital, the higher risk not for our medical officers, but also for other patients in the hospital as well. So this is the time that we should help each other and trying to chip in whatever we can do. And probably at the moment, if you ask if there is anything Thai people can do, I would say you can do a lot of things. I have seen the pictures of some of the restaurant or some of the food shop that offers some food to someone who may not be offers for the food at the moment. I think there are a lot of things that you can do to help the situation. Probably not in terms of health, but we already know that the effect of COVID-19 now already surpassed the health issue. It has affected people in terms of economies. A lot of people may lost their job recently. So at the moment, there are so many things Thai people can help each other and trying to put the situation back to normal as soon as possible.
So your message is thank you for the hand claps, but please stay home.
Stay home.
Dr. Tanarak, these days when you wake up in the morning, you must have checked up the number first thing in the morning. I don't know, perhaps you have to do that. How do you see the trend or the global situation of COVID-19? Any insight in the near future?
This is just the beginning. I repeat, this is just the beginning for almost every countries. For almost every countries. If you see the numbers that the Germany said that the disease will stop if German people, about 70% of German people get infected. The number is, the estimated number is the same in almost every countries. When you ask them, when will the disease stop? Most of the leader in the world would say around 50 to 70%. So you can do a calculation. We have a lot of people in the world, but the number of infected at the moment is still at around 400,000, right?
600,000.
600,000, I'm sorry. So this is just the beginning of the epidemics. And you see the situation that will roll on in the next few months. In some countries that implement very strict control measures, we can see the downward trend. But for the countries that does not implement effective measure yet, we could expect the rise in the numbers very soon to the situation that probably may out of their hand in even for some countries that have very strong public health system.
So Prime Minister Boris Johnson of the UK was right when he said that things will get worse before they get better.
Right. But I would like to mention one thing. I personally believe that no countries in the world could let the disease spread freely because their health capacity could not match the number of severe cases. If they are not doing anything, every country situation will end up like Italy, where so many people, where the doctor have to choose who they will help or who they will not. So even for the US, so at some point in time, every country must trying to do a very strong social distancing interventions in order to slow down. I repeat, to slow down the situations. So I personally believe that if we do it voluntarily, it won't hurt that much. But if it is a compulsory lockdown, we will hurt for some time. And then when we reopen the country again, reopen our doors again, we still have to work very hard in trying to contain the disease still for some times. So understanding the situation at the moment, know what to do, and trying our best to try to cope with the situation and understand that we have to live this way of life for quite some time. I think it's the most important things that we have to learn, and we have to adjust ourselves very well, not just socially. I mean, within our house as well. I would like to give an example. Let's say that, for example, if I have my father living with me, and he is 80 years old, and I still going in and out of the house every day to work, and so I will be the highest risk in my house. And if I come back home and do the same things, that is, eat at the same table with my fathers, and watching TV together, and do every routine still the same way, the risk will be at my father's. So how to minimize those risks to try to for him to have the smallest risk as possible is something every household, every family have to think about and have to adjust their home to accommodate the risk as much as they can. This disease is the disease that affected the elderly more than the young.